there every day, but these are neighborhoods that we avoid. I talk about, the juxtaposition of very, very rich, wealthy, concentrated neighborhoods of affluence with neighborhoods of concentrated poverty and high death rates. And yet people in the affluent neighborhoods never see the folks who live in these other neighborhoods, never stop by. And while they're physically close, the social distance is huge. So we could put all the doctors and nurses in the world in these neighborhoods, and we wouldn't solve the problem if we don't get to the structural underpinnings of this.
Right, because
and I call it
the doctors can only provide so much treatment for the sort of, I guess, the health abuse that takes place because of everything else that's around there.
Yeah, and I think it starts with stress, and I think it starts with stress that begins in childhood. It begins with being surrounded by other folks who are in stress. My experience in 40 years in Chicago, I've worked at 3 hospitals along one street, Ogden Avenue, and I call my experience one street, two worlds, because my patients and I experienced how health systems vary. So the other thing that happens in here, because we have a virtual apartheid healthcare system where black people in this country and brown people get care at different institutions than white people, and those institutions tend to be impoverished because of the payer mix of the patients. Because if you don't have good insurance, the hospitals can't make money. And so you have the concentration of poverty in neighborhoods. The institutions that are in these neighborhoods are impoverished themselves. They can't capitalize. They can't attract the same kind of doctors. The folks who work there do yo men and yo women's job of trying to take care of patients, but things are just out of reach. And yet down the street, like at my academic medical center, which takes care of everybody, but takes care of a lot of good-paying patients, we have the capital to expand our services, to improve our quality of care. And so you layer that onto neighborhood effects, and you have really a situation that's criminal in the sense that we're the richest country in the world, and we allow not only our children but other people to suffer in this way when it's completely unnecessary. And that's why I argue, even though a doctor and nurse in every corner won't make a difference, having a universal health care system in which everyone has the same access to care is one of the solutions. But the other solution is we need to invest in these neighborhoods. I used to call it segregation and disinvestment, but now I say it's racism and exploitation. And, we put billions of dollars into Iraq and Afghanistan. If we had that same intention with our high poverty neighborhoods, which have actually increased in number, the wealth gap in the United States has increased since the 1980s. And if we put that same kind of reinvestment in the United States, in these neighborhoods, we'll see health get better. By the way, I focus a lot on neighborhoods that are African American and Native American, but I also point out that in the United States as a whole, life expectancy has dropped in the past 2 years, and it's dropped because white people without college degrees are dying at unprecedented rates for some of the exact same reasons. Economists call these diseases of despair. And diseases of despair because there's the opioid epidemic, but also the lack of progress in heart disease and cancer among white non-college educated people have made their life expectancy experience that now of black people in the United States.
And again, it's not it's those things that are driving the increases in the presence of those diseases. Let's talk a little bit about immigration status. You tell a story of a 25-year-old woman, and I may be mispronouncing her name, Sarah E. Yes.
Yeah.
Tell us about her and how that's indicative of a problem in relation to immigrants.
Well, you know, immigrants to this country put money into our Social Security and Medicare system, and accounting for the fact that these systems have been able to be prolonged, but they don't take the money out, and yet when they get sick, they don't have access to health care. Sarah E. was 25. She landed in Stroger Hospital of Cook County, which is the public hospital literally across the street from my institution. The doctors from my hospital, the transplant service saw her. She didn't have insurance. She then mother tried to get her into Northwestern, where they were, interested in her immigration status, and she was uninsured. And she died waiting for an appointment. So her doctor finally called and she got an appointment, but never lived to see the appointment. And she had a disease called Wilson's disease of the liver, for which, had she qualified, she could have got a transplant. That doesn't guarantee she would have gotten it, but at least she would have had a chance at it. It turns out that her cousin came to work with me one summer while I was working on issues in transplants, and I asked her to interview her aunt, and her aunt said, they asked us for $150,000. We can't even raise $10,000. So it's the way that inequality kills. In Canada, when people immigrate to that country, everyone gets health care, and that should be a human right for everybody. They're needless deaths. And I've seen people who end up on renal failure and kidney failure simply because they're undocumented, they're uninsured, and they couldn't get their blood pressure and diabetes taken care of. It's much cheaper, much safer, better way to take care of people for their primary care conditions than wait for them to die. But in the United States, we never decided that healthcare is a human right, and it's, like I said, it's an unacceptable proposition. And as a doctor, and I know many doctors and nurses out there, to witness this, when you know you can do something about it, is so heartbreaking. And when we know there's a fix out there, and it's painful.
Hi, folks. Sam Seder here. We still need your help on our Patreon page. YouTube ads have come back, but not nearly as much as we had before. So if you can help us out, any little bit helps. Head over to our Patreon page right at this URL, and you'll help us keep helping you by making videos